It's time. All right. So welcome everyone to a very exciting webinar today. We are going to get into some of the trends, the numbers, the on-site experiences in different communities on homelessness. So hopefully you're in the right place and interested in the issue. We've got some excellent speakers today as well, representing diverse perspectives from small and large urban centers as well. But as folks chime in or log in, we always love to hear where you're joining us from, and a good opportunity for the team to test the chat function. So if you guys want to find the little chat function and say hello, would love to get to know where you're from, and essentially you have an opportunity to tell us your name, your organization. If you happen to know the Indigenous territory that you're joining us from, it's also a great way to learn about that from across the country. And if you're not familiar with it, then it's a good one to kind of Google as folks join in, so that you'll know it for next time and other opportunities. All right, so we got Natasha. I'll do some shout outs as people join, because I know it takes a couple of minutes for everybody to come on. Rohit, oh my gosh, it's going too fast. St. John, New Brunswick. Lisa Cirulo Seguin, I hopefully didn't say that wrong, from North Bay. And Lynn, Vancouver, Musqueam, Squamish, Salewheat, Slale. Oh my gosh, yeah, what tooth? Okay, hopefully I got that one right. Jessica, Airdrie, Alberta. Hello. Hi, Jessica. We were just on the plane together. So this is crazy. There we go. Who else do we got? Cornwall, nice to see you. Toronto, of course. St. John. And Chantel from Cornwall. There you go. Lorna from Nanaimo. So I'm guessing you're Nanaimo. Guelph, Ontario. Calgary, my hometown. Chris from Ottawa. Hey, Chris. Nicole from Calgary. Amazing. Well, keep saying hello in the chat. The team on the help seeker side is monitoring that. But in the meantime, I will get our party started. And again, welcome you. We've got folks from across this beautiful country joining us, and wouldn't do us right talking about homelessness without acknowledging the TRC calls to action and how many of those surround the overrepresentation of Indigenous people in our homeless populations, and the work ahead needing to have that lens as well. So throughout the presentations, you'll hear that from our folks. And in fact, Susan's presentation's specifically going to touch on that as well. So thank you for joining us. I'll start sharing my screen now, just so that we can see what's in store. And there's quite a bit of stuff that we need to share with you. We have 3 speakers. Like I said, myself, I'm going to give you the state of the numbers, if you will, and what we're seeing across the country, and hopefully some new insights, some new ideas that you might have been less exposed to, just to give us a kind of, not necessarily a directional, but at least inform some of the directions from a national perspective. Susan, CEO of Homeward Trust, a good friend, and been in the sector for probably our entire careers together. She precedes me, but and leads the systems planning organization in Edmonton, responsible for homelessness initiatives. She'll tell you lots about that when her turn comes. Jamie, who is a social development specialist at the city of Penticton, that is a mighty team of one on leading the municipality's response, not just to homelessness, but to social issues in general. So she's going to bring a really interesting perspective from a smaller startup municipality in the social space. And for those that are coming to this work from that context, I think you're going to have some great insight on how to move things forward within limited budgets, limited resources, and a new mandate for a municipality. And because we don't want to leave you hanging with just policy concepts and frameworks and data discussions, we wanted to show you how the municipality is also rethinking its internal approach from a systems integration lens. And that's why Angie, who is leading the bylaw team in the city of Penticton, and her work with Jamie on doing business differently as bylaw and shifting the role of bylaw from a social perspective as well. So some practical, some policy, some programmatic, and some data insights is what we want to bring to you today. And with that, I'll get into it. So I'll talk to you about the data trends. We'll move to Susan, and we'll move to the Penticton team, and really want to make sure we have time for Q&A as well. So we're going to monitor that, but we'll have them at the end. The team on our side at Help Seeker will keep an eye on those. And if there's obvious things like, are we recording this? Yes, you'll get the recording, you get the deck, and all of that too. But yeah. Let's start with 2 seconds about Help Seeker and why we're in this conversation. So we work on data and data-led solutions to complex social challenges. And while we're not limited to one specific challenge, such as homelessness, we work, as you can see, everything from guns and gangs and mental health, affordable housing, domestic violence. We get to see the connection between all of these social challenges. And so the data that we bring into some of our community work, the insights that we bring, we always feel the responsibility to bring that back and share what we learn as we learn it, and look at these connections, because social challenges are not one-dimensional. Homelessness itself is not one-dimensional, but it's actually one out of many social challenges facing Canada and developed economies across the world. So it's sadly not unique to Canada. In fact, we're doing some work in the US nowadays, and seeing some of the ramifications of the post-COVID climate there as well. So quite significant challenges across North America, for sure. And things are shifting quite a bit in the environment. So we do need to have different conversations about how these components are connected, and how public policy in one arena can be done in isolation of these other aspects. So that's about us and why we're in the conversation. What we're seeing from a national context is quite significant as well. So in the Canadian landscape, the COVID pandemic in some ways buttressed the visibility of social challenges, simply because we were paying attention to what was right in front of us and what was impacting our personal risk immediately. The public was indoors, so things weren't as visible to folks in the downtown cores, for instance. So there was a lot of shifts that happened during that period that are, coming home to roost, if you will, in the post-pandemic timeframe. So there was talk, there was research, there was data collected during COVID that was signaling that these issues will, flare up. And there was calls to action during that time to say, well, what can we do during COVID that's going to set us up for these ramifications not to come to fruition? And some things were put in place to that end. The National Housing Strategy, for instance, is a example of, if we are able to deliver on that National Housing Strategy, then in theory, we're going to be able to manage some of this stress longer term. If we put in some of the health reform and equitable access to health supports for vulnerable populations, or populations that tend to be marginalized or experience systemic racism, then we might be able to withstand some of these pressures downstream when the COVID impacts really materialize. But of course, as with all good intent, the ability to mobilize, to transform systems quickly and in an agile manner is obviously very hampered by inertia in some ways. And so we're unfortunately seeing long years of policy challenges that have become exacerbated by that time period. And now we're also facing an economy that is feeling the significant pinches of that COVID response and COVID impacts. So the inflationary pressures, the affordability crisis, things hitting the mainstream, the arguments pro and against certain social responses, the arguments around harm reduction is a really good example of things that used to have a middle ground that tend to be quite divisive now. So needing to find a path forward that's data-led, evidence-led, but manages to reconcile these tensions, because there's truth on all sides, but we kind of need to bring it into a more logical middle for the better decisions to win in the end. So that is the context for the discussion, that homelessness is one of these manifestations of these deeper social challenges being experienced. So I do want to give some props here too, and not just because Chris is here, but one of the benefits of having a federal government that has been working in the homelessness space, and that's oftentimes, with some chagrin from other levels of government in some spaces, that we do have great data to monitor some of these impacts and what's happened before and after COVID. And so we do have data during COVID as well. It's, there's a billion reasons why homeless counts were really difficult during COVID. I don't need to tell you about. But what's interesting for me as a researcher that likes to layer data is to look at 2016 and 2021. So like a bit of a longer time span. We're now in, comparing census periods as well. So we have a population that's more diverse, a population that's more urbanized, a growing population in most urban centers, not all, because regionally we're losing, we're definitely losing ground in some rural communities for sure. But in terms of the homeless populations that we do get data on in these point-in-time counts, we can see that there is more chronic homelessness. And if you're new to the homelessness conversation, what chronic homelessness refers in GOC, Government of Canada parlance, is that long-term homelessness of people experiencing that 6 months and over in homelessness, even though there's now talk of saying 6 months, that's just, that's no longer considered chronic. We need to almost up that to truly capture the new type of chronic homelessness, because people are stuck in the system for even much longer periods. And then the other piece that's of note, and I know 5% may not seem like a lot, and again, take that with a grain of salt in terms of what we're able to capture in a point in time, but we do have indicators from the data that we have more unsheltered folks, so more outdoors and encampments as well. This is one data source. What we see in the media, though, what we see in encampment reports, what Ange will talk about as well, is going to be indicative of some of these visible impacts of unsheltered folks that are either moving from at-risk and hidden homeless populations directly into encampments, or so bypassing that system altogether, the shelter system, and what that is also doing to our ability to respond in an effective way. A couple other points too, and my colleagues are from York Region. I was just there last week, spending some great time with the York Region departments that are leading the work on homelessness, and I think some of them are here today with their benefit of amazing data set there too. I will say this is really probably the cleanest data set I've ever seen, and spanning a long time. So we can do some of these, the HIFIS data set in particular there is really rich, especially when we layered it with some of these other insights. We can see the population is getting much older. So looking at 2017-18 compared to 2023, so this is what's been happening in that time period. The population experiencing homelessness coming in for support is on average 12 years older. So that's significant, right? We're looking at an emergent senior homeless population rather than kind of that younger working age group. So think about that in terms of health interventions, the kind of housing and supports that they need, the complexity of care, long-term chronic homelessness increasing, unsheltered homelessness increasing. The other piece that's, again, 5% may not seem like a lot, but typically we see a predominantly male population in those seeking that sheltered intervention, that formal system support. And what we're actually seeing is an increase in women. So the 70-30 is more of a 65-35. Why that's significant is this is unexpected. This is novel. This shift in the gender balance is telling us that those hidden systems of support, for good and bad, because they're not always safe. Those housing situations are not always the right placement, but those are breaking down, or there's again something going on there where we're seeing more of that population coming into the system now. And then sadly, the overrepresentation of Indigenous people has not reversed, right? We haven't made those gains in terms of the calls to action on overrepresentation. So whatever we're doing there, we're not seeing the trends go in the right direction either. So with that being said, I wanted to again be a little bit more provocative and say, well, we know immigration, and that the call for Canada to keep bringing in newcomers and folks to maintain our economic growth and vitality of the country, that's not going anywhere. The 50 million by 2030 is a very optimistic Statistics Canada projection for Canada. It could be more around the 46 million, but the point being is we're already at 40 million. Our population is going to continue to grow, primarily driven by bringing folks in from other countries to support our economic growth. However, and we're seeing that the signs of this in our fellow Ontarians in the room, and those that are picking up some of these settlement challenges and saying, hey, do we actually have the system to support the housing and service system to support this settlement, this massive settlement? I was in Halifax at the Canadian Alliance to End Homelessness, and I spent a day with a very unwilling but then made excited husband to learn about the Great Migration into Halifax and the processing capabilities of resources that went into that settlement system as the Great Migration happened into Canada to settle the prairies, et cetera. Those systems, we're clearly seeing signs that they're not in place currently. So how are we going to respond, and will this growth be truly met with the right systems of support to keep up? So will our homelessness response capacity keep up is the big question for me. What you're seeing here is a map that is a result of a collaboration with Canada Mortgage and Housing Corporation, where they wanted us to take a look at Canada's emergency and transitional housing system across the entire country, and take a look at those service gaps and service deserts, if you will. Yellow means there's nothing near there. And then of course there's layers, like clearly you can see where we got dots, we've got things happening. Where we don't have dots, we have nothing happening. And so it's not surprising that we see this flow into major urban centers, and this kind of the loss of populations where we don't have those on-site supports, and unfortunately where those supports tend to also be communities with high Indigenous populations as well. So when we think about forecasting homelessness and where we might go, like I said, we've got the benefit of decades of data. And as a data person, I'm telling you, it's not about the data, it's about what we do with this data. It's obviously disconcerting when we've been collecting this for years and years, and if we're not using it for action and policy, then we're missing the point of collecting it in the first place. But what we did do with the data is, again, putting it through our mechanisms, looked at shelter utilization. We have, again, the benefit of working with hundreds of communities and seeing what those ratios are of how many people go through the system, come out of the system, what is the performance of the homeless serving system in different contexts, where does it perform well, what does that look like, and where is capacity need to go for us to meet this ongoing demand. What you can see here is, based on the current growth trajectory, we are today, and I'm happy to debate this till the cows come home, and you don't even have to buy me a beer, I'll buy my own. But Canada's homelessness estimated to reach that 550 to 570,000 in the next 10 years. Now, that doesn't mean that we're going to to only be looking at that encampment, that visible homelessness. I really don't want people to run away from here and say, we're going to have 500,000 people experiencing absolute homelessness. That's not true. We have layers of visibility. We have rough sleeping and encampment. We've got people that are in those unsafe situations. We have people that are in the couch surfing, et cetera, as well. So I really want us to consider that. And that's why this arrow is here, is to say that it's actually quite fluid, right? People go into that very, very at risk, basically one paycheck away. You're spending more than 50% of your income on housing. You've basically got no cash for food. You're going to the food bank. You're in that very precarious housing situation and probably have an eviction notice going. That number is increasing. The affordability challenges are there. Our social housing hasn't kept up with that need. But we have this estimate, if we're going to build and respond, we think that 500,000 is 550 to 570 is the number to start doing some projections in terms of what we need. So how might we close this gap? It's going to take a lot. It's going to take complex care and supportive housing, beds that come with very intensive supports, medical, right, sociocultural appropriate supports, social care, et cetera, very intensive supports there for that complex care. We need that recovery and transitional housing, so more time limited, but people come in and out. They have the supports around addictions, mental health, employment, youth, even families that might require that transitional type of care. Emergency shelter and rehousing support. So looking at emergency shelters as almost resettlement centers, places of opportunity rather than places of where people kind of replace the housing that they needed with a bed, a long-term bed. But either way, we have a major gap in that crisis response. And there's nothing telling me that the climate crisis, some of the economic crises that have been coming and going are going to go away anytime soon. So we need to build that crisis response so we can be there when people need us. Intensive case management and rent supports, light case management and financial supports, keeping people in the private market where they are able to be stabilized with outreach case management support coming to them and wrapping around them with the right level of financial subsidy. It's very sad when you see the numbers and majority of the population that is coming into the homeless system is on income assistance. And so we're band-aiding a failing system, a social assistance system. So we need to reconcile that because we're paying for it no matter what. So how about we get it right? How we get those financial subsidies right? And at the end of the day, the long-term solution is going to continue to be that supply. So CMHC talks about the massive gap we have in just supply for general affordability. I would argue that we need to put our stake in the ground and say we need that deep subsidy social housing, non-market housing operated by municipalities, operated by nonprofits, a third way. We cannot rely solely on the market to get this done. That's scratching the surface of what we need to even get to OECD, developed economy standards. That's not even getting us halfway there. We're still giving some of these housing loss preventions, financial subsidies and rent supplements to, as you can see there, 466,000 households in our model. But at the end of the day, if we're not able to build these systems now, these trajectories are going to go unchanged. So it's a bit of a call to action there because it's going to cost. Right, so we're estimating the CapEx, so the capital investment in meeting those beds and units is about $4 billion for those complex care clients, and then $165 billion for those affordable housing, lower needs housing units. And when it comes to wraparound supports and those financial supplements, so that intensive support, everything from substance use, medical health, preventative social care, well-being supports, $6 billion per year, and then $10 billion per year for the rent supplement, damage deposits, first month's rent, utility arrears, and et cetera, that income assistance component. Now, the good news is we do have about $1 trillion every year that is going into the social safety net. So it's going into everything from addictions and mental health, homelessness and housing instability, and community personal safety. So can we afford it? First of all, we can't afford not to, but I would say if this funding was targeted towards homelessness, if parts of this funding could go towards the right interventions, we could repurpose what we have. And yeah, we probably need more as well to meet that supply need around non-market housing as well. But at least let's optimize what we have to get the right results first, or at the same time. So those are my remarks. I'm happy to debate the numbers and look forward to your insights, but I thought I would put something out there for us to do so and contextualize what Susan's going to be talking about. Go for it. And of course, you're on mute.
Yeah, of course
I did. You're good. You're good. You're good.
Yeah. Okay. Thanks, and appreciate everybody taking the time this morning. I'm going to give an overall update on some of our work to kind of dig deep, and the understandings that we have from our data. We're one of the communities that have been collecting data and have been resourced well to do so for many years. We, as an organization, I'll also touch on our history, but we'll touch on this ARCH project. So there's several communities across Canada that have been able to secure some funding through the federal government for action research on chronic homelessness. And I'll highlight that, but it's really more so an update on what we're doing, and as we face the same crisis that many communities are, that Alina alluded to. The Homeward Trust, super fast, but for those that don't know, as an organization, we are the entity for reaching home. We also have provincial commitments to end homelessness and resources that are committed through organizations like Homeward Trust. So in that respect, we refer to the community-based organization model. But the organization also was a merger of two other organizations in 2008 to pull together the planning, the allocation of resources, the contracting and subcontracting. But in doing that kind of merger, it also centralized our ability to do some of the data work that I'm going to speak to. So I know that municipalities are often in this role. We work very closely with the city of Edmonton, and there are a lot of roles and a lot of necessary roles if we're really truly making an impact on this issue. But I'm often, all of these things are not like the other, and each community has a different response. So just to give you a bit of an idea of who we are. The update on the data side. So been doing a lot of work to look back, and through the we started actually administering skivvy dollars in '99. So you look through that whole journey of what that has meant over the growth of the program federally, and then the work with the province that really started kind of 2007, prior to the plan to end homelessness, some research that was done with 7 cities in Alberta. Through all that growth, we have a lot of data, and really asking ourselves now, in an environment that we can all, I think, admit is becoming more complex with the stakeholders and the kind of information we're relying on, are we doing a good job with that data and cleaning it up and really making sure that our definitions are clear enough that we can rely on it in our analysis? And a ton has been done this year, but there's certainly more to come. Making sure that we are in a position to get the kind of insights that when we know what a lever is, and if we change what we're doing, that we can tell whether or not it's making an impact. We've been able to do that very effectively at kind of housing first levels. I guess at a really high level, housing first in our community has proven itself to be a very, very effective intervention. When we have more system players involved, and when we look at what ultimately is the role of a system planning organization, to see the entire journey of inflow, program investments in that optimization of the system, and trying to reduce the time frame that anybody experiences homelessness, and finding those long-term and sustainable solutions, that outflow, those all rely not just on what we're able to fund and the system that we play a significant role in the homeless serving system, but all of the other challenges. And Alina's touched on a number of indicators and things that where we do that predictive analysis. We're talking about some of the numbers here and what we're relying on in terms of predicting how many supportive housing units do we need. Well, that has a lot to do with how the rest of the system's performing. So that's what we're digging in a lot, and I'm really excited about that work. When it comes to unsheltered homelessness, which is top of mind for many, I don't, it's almost repetitive. Since we've started this work, we've always understood homelessness to be a complex issue, that it is a health indicator on its own. And if we didn't need a pandemic to underscore that, but it certainly did. But then when we look at now, where are we at? There are A lot of contributing factors to where we're seeing this increase in encampments, and it isn't just one, and it's not just about product in our mind, and it's not just about available housing. There's a lot that has disrupted our safety net, our services, and our communities, and frankly, connections that individuals have, and the supports that they relied on 5 years ago that are very, very different today. So we really need to have that broad lens if we're really going to solve this issue. And I know that, there's some narrative and some discussion about getting used to or trying to have an accommodation that encampments are with us. I really kind of retract from what feels like a very hopeless statement in that, and really want to look at how we can prioritize and look at that big picture and all of those impacts. And we can't just, be waiting for housing to be built. So while we're having that conversation, it's getting bigger. There's a lot of competing priorities. There's a lot of stakeholders in the mix when it comes to the impact of the increased homelessness in any community. And we're certainly, we've named some here, and the impacts are very kind of real time. So this isn't, 5 years from now, we can be waiting for solutions. There's real and immediate impacts, in particular for those unsheltered themselves. We have a really significant increase in deaths directly related to being unsheltered, and directly related really to an experience of homelessness overall and the health failures that folks have. So this is immediate and urgent, and we need to treat it like the crisis that it is. And so from that perspective, trying to look at new solutions, different solutions, we've prioritized in our planning work supportive housing. We've been very fortunate to work with the city of Edmonton and with some federal capital and reallocating our provincial dollars to stand up 5 supportive housing projects, and we've got a couple more underway. It's been not missing, like we've had some supportive housing, but the kind of housing we're really focused on is for folks that do need that set 24/7 intensive support and models that are really adaptive to the folks that they're serving. So we've been fortunate to be able to do that, but the need is certainly quite a bit higher. And historically, we've been able to rely on, and we still rely on, our relationships with private landlords for our Housing First program. The vast majority of the folks that we house in Edmonton through our programs are in market housing, and working with landlords. But having said that, there's new and different barriers to that work. Some of that has to do with the complexity of the folks that we're working with that have been in encampments, or the chronically homeless folks that have a higher level of support than we can certainly offer in those private landlords. And we have bottlenecks, and while we have those bottlenecks, we need to be creative too about those other systems that we work with, trying to just connect people as quickly as possible to options. We've, through the pandemic, many communities worked with a hotel model in terms of keeping people safe. We've been able to take some of those opportunities and sustain them as bridge housing. So very, very continuous stay shelter, for a lack of a better description, but bridge housing is a very active engagement with folks in identifying and getting supported to access housing. It's kind of meeting again a niche in the work we're doing, but we have also tried to, shuffle roles internally, shuffle roles on our coordinated access team to be more focused and more impactful. And we'll continue to look at those long-term supports, but the system itself, what we are also learning, I mean, just constantly, the thing I think about this whole discussion about data is that or we need to be constantly learning. And as we build more, and we're supporting folks, making sure that we're really aware within the system that we're working, that those other system supports that we rely on, even when somebody is in a supportive housing project, are not just available, but the right supports, people can connect with them. Otherwise, we do end up with, again, another bottleneck in the system in terms of people being able to move to other levels of care. So lots of good things going on, but very much something we're constantly aware we can do better. The Arch project. So just quickly on this, we have a project that we will be focusing on the unsheltered. The kind of defining of it has been through community tables and talking about the priorities that we need to focus on as a community. And we do have in this project a bit of a different relationship, where the federal government also has a commitment throughout to kind of help support the project and working with advisors. In doing this, we really see an opportunity. I mean, we always want to be prioritizing lived experience and living experience voices. We also, in this project, will have some time to dig deeper I don't know that we always really are very clear on what's true. And frankly, there's very individual pathways in and out of homelessness. And we will have with this project some time to take a bit of a different approach in terms of how deeply we can dig into that experience and look at some of the longer term relationships that might precede somebody's experience of going what we see now sometimes straight from eviction to the street, which is not that it didn't happen before, but we didn't see it happening as much as we are now. Again, data driven. I mentioned some of those sources, but there's uh, there's some things that we want to explore that maybe are not the obvious. I've raised and I keep thinking about, it wasn't that long ago in the last 3 years that various times it was illegal to have somebody sleep on your couch. Alina talked about the number of people that are at risk of homelessness and that how that quickly those folks may be moving into an absolute homelessness. And from the perspective of the by names list, what else is contributing to that? How much has that disruption affected just how people are relating to each other and perceiving safety and connection and community? Because we know that that connection and community is so important, and sometimes it's through the encampments that it's being reinforced and made available. So we just really dig into that. So I'm very much looking forward to what that project reveals in the long term. And then just I know, and I want to just probably the last point first. People are tired. This has been this work is challenging by all stretch in any role anybody's playing. I think it's fair to say too. There's been an explosion of uh, really appropriate and needed advocacy, and also kind of commensurate pressure and demand. And it can feel sometimes like when you're working on the front line, you just it's hard to know you're doing the right thing, let alone do things right in terms of actually supporting folks. It's very weary, and supporting all of you. And if you're in a policy kind of role, bearing that in mind that there is a toll that is occurring within the sector as we sit here and look at some of the charts and the numbers where, a trillion is the new billion. We're seeing this resource gap, and it's really huge. So I want to just start there, and then like from the other perspectives and other work we have as an organization been investing more in supportive referrals and prevention initiatives that haven't typically been a big part of our role, but we've certainly been investing more in that. Thinking and talking about recovery and housing first, I will underscore, is a recovery oriented focused program. And as we're working with folks, though, there's other available at our systems in Alberta have emerged with other offerings in terms of connection to treatment, making sure that we are really included in and providing those opportunities as those new services come available. And yeah, keeping up. There is such an urgency, and I'll just leave it there. Hopefully that helps.
Awesome. Thank you. Thank you. And appreciate all of us like packing so much insight in. Hopefully this gives you a tidbit of the expertise that Susan has amassed and her team has amassed. And although they don't like to advertise it, they do actually help a lot of other communities out there as well. So it's also about connecting you guys with each other if there's ways to learn and contribute to each other's efforts. They're really lovely colleagues for other communities. Thanks, Susan.
Thanks.
So you're off the hook, but now we've got Angie and Jamie on the hook. And I mentioned a little bit about their work. Angie leads a team of 8 CSOs, community safety officers in Penticton, so on the front line of their response in a very different way, right? So not in that enforcement typical role. And then Jamie, coming from a background in the homeless sector and now moving into from an NGO nonprofit side into actually doing the work at the frontline level, and now moving into that policy role at the city of Penticton. So I'll hand it over to you, ladies, or folks, and I'll move the slides along for you. Do my best to do so, but if I need to go back, let me know.
Thank you, Alina. Welcome, everybody. So yeah, pleased to be joining you today from Penticton, BC, on the traditional, ancestral, and unceded lands of the Syilx Okanagan people with my colleague, Angie. We want to talk a little bit today about our work with Help Seeker, particularly kind of how we started at a very baseline level to start collecting data about our community. Um, Penticton, interestingly, is a small community of about 37,000 people. We're one of the only 2 communities in the world that are nestled between 2 lakes. But despite that, we've seen really significant growth and development in the past 4 years or so. But obviously our growth potential is very limited because of our demographics. And we've really been noticing some of those bigger city challenges. And I think for probably many of you listening, whether you come from an urban center or a smaller rural community, we're all starting to notice some of the same things. What's really interesting just about the unique context of Penticton is that despite having a population that is aging significantly, we also do have a huge rental population. So about 37% of people in Penticton are renting. And there's a far greater proportion of households spending 30% or more of their income on rent. So a significant amount of our population living in core housing need. So when we started some of this work, we really needed to understand just some social data, our baseline demographics of what was going on in the community. I'll say this as well, Penticton being the size we are, when I started in my role about 2 years ago, we weren't a reaching home community. My department didn't have a lot of resources. And because of our size, what I often say is we were too small to be a big city, but we were too big to be a small city. And so from a funding and resource perspective, we were often left out of some of those funding calls. And it made it really challenging to sort of set some priorities moving forward, but also to just understand what the needs were. You can see on this slide, we have a median income of about 68,000. So huge need in our community for workforce housing, for that missing middle. But at the same time, again, we've been seeing huge social challenges. So if you want to flip to the next slide, none of these will probably be a surprise to any of you who are on the call today. But what was interesting for us was kind of contrasting this to other communities. So if you go to the next slide, one of the things we found when we started this project was that our ratio per capita of homelessness is actually 2 times higher than Calgary. And in addition to that, also saw a lack of resources and not sort of a clear plan of what we needed to do to address this. I want to highlight a couple of stats on this slide as well. And this is from our most recent point in time count, which showed at least 71% of folks, were experiencing some type of addiction, and at least 58% were experiencing some type of mental health challenge. So, we're seeing highly vulnerable folks that are unhoused, that are experiencing comorbid conditions. And then we're contrasting that with an aging population, limited growth potential, and trying to figure out sort of where we move forward. So we started looking at some of our data. And again, I'll highlight, this was things we didn't have when we first started this project. And we saw a lot of really stark contrast. So you'll see here, we have a huge unregulated drug death, a lot of crime in our community that we were trying to address this. But at the same time, we knew that we actually had quite a few resources in the community, and bringing them together and coordinating them would be really important. And this is where we started to sort of implement a systems integration approach. The role of social development from a municipal perspective is something that we've really been grappling with since I came into my role. And that's in part because municipalities in BC don't necessarily have a mandate to deliver social services, but nevertheless, we are the closest to the people, and we have that immediate feedback loop and some of the relationships with the service providers. The way that we really wanted to go about things was setting up a very highly sophisticated department that would be data driven, that would understand the data of our community, the needs of our community, but then also tie that into building relationships and cultivating trusts and understanding priorities and where folks actually sit in this work. In terms of just the role of social development, we actually started to take this data and build a social development framework. And for those of you who are listening, whether you come from municipalities or if you're sort of the system planning league for your community, we wanted to do this in a way that blended the quantitative data, so through our work with Help Seeker, but then extend that a little bit further into the qualitative. So what are lived experience folks saying? And in addition to that, where do our service providers fit in this role? So when we kind of completed the initial scoping of our data, we actually went back to the community and said, these are some of our needs. What is the strategic focus of your organization moving forward? We also did that as a municipality. So we have a big role in social infrastructure in the same way that we do our physical infrastructure. So when we're looking at housing developments and we want to see if we have the sewer capacity or the road infrastructure to support it, we can actually start asking things now like, for example, do we have enough primary care physicians to meet the demand of our population? And those are things that we've been using the data for. In terms of building partnerships, I think if there's one takeaway from our brief presentation, I hope it's this. Planning out social needs and understanding the need, it can tell you the what, it doesn't always tell you the how. And that's where you lean in on your relationships on how you do that. When we went through this process of just starting to identify the programs, it told us some questions about where there's gaps and where there's opportunities. But I think beyond that, it also just told us where we need to focus our efforts moving forward. One of the things we did beyond just understanding, the supply we have in the community was the relationships. I'll give you just a brief anecdote. When we were asking folks sort of referral pathways, how you share information, how you communicate with the sector, we actually had one government entity that had multiple staff fill out the survey with different responses. So there was a time where we thought we had a huge resource gap, and it actually just turned out to be a knowledge gap, and folks didn't know how to access those services. So these are the types of things we really wanted to dig into before we made funding recommendations for services moving forward. And then I think most importantly was the lived experience component. So one of the things we were really intentional about with this project is, not just asking about the experience alone, but the journey of an individual. So tell us about when you first experienced homelessness. What would have prevented that? And tell me what that journey looked like. Did you have to go to the shelter 4 times? Did you have to fight a caseworker? Because those are the things that are going to help all the data that we have to make those recommendations moving forward. And I'll say this just around the supply and demand piece. And I mentioned this earlier, you can look at data, you can chat with the sector, and you can chat with lived experience and really understand what is needed. But equally of importance is understanding your system's capacity. And this is something I think that Angie will speak a little bit about too, and just in terms of what's realistic with what you can do moving forward. I think at times there's a bit of a bias towards addressing the immediate need because that's what we see. But when we start to look into the data in terms of the long-term needs, it allows us to start planning in advance. So one of the biggest things, and actually Alina touched on this from a national perspective for us, was starting to learn that we have a significant lack of long-term care available in our community. And we juxtapose that with an aging population, we know that we're going to have concerns moving forward. In terms of that system's capacity, though, really important just to know where folks sit in this. So for Penticton, we've been developing a public safety framework and a social development framework. We want this to address both, community safety and well-being, but most importantly is coordinating where folks play a role. We brought together the sector, and when we asked them where they see themselves in their work and they identified this, we've actually used this as a tool to go back and say, hey folks, there's a grant available for, substance use projects. Organization X said, they want to take a lead in this. Let's support them in their grant application. Let's rally around as a community and make the best use of our resources. And that's the type of decisions you make that come from trust and consensus in the community. I think really when it boiled down to it, when we were looking into this, we kind of had two sort of prongs, and there was sort of the social crisis component of what we were seeing in the community. And underlying that was poverty and systems failures, I think, as many of us will know, and then also crime. And we wanted to make sure that we were understanding these both from a meaningful way, where we needed a public health response, where we needed to build relationships with partners and use data to make those long-term decisions, but then also where we could use that data to also kind of innovate on the ground practices and how we do that in a non-enforcement way. So with that, I'll hand it over to Angie to talk about our CSO program.
Thanks, Jamie. Thanks for joining, everybody. Just a little bit of background on our program here in Penticton, the Community Safety Officer Program. We were officially branded in 2019, and it was really just myself and my partner kind of going out and seeing where we best fit in the community with the increase in social nuisance concerns. And the whole intent was to sort of provide that dedicated and connected approach to help support the unhoused population, but also help support stakeholders within the community. And when we first started, we didn't really know any of the programs or the services that we had in community. But as we've evolved, knowing the data of what Penticton has means that we can be a resource to community, sort of being able to see those gaps and seeing how we can fill those gaps. The program itself really requires officers to get to know the unhoused population, and the whole goal is to know everything about the individuals that you're working with. So 1 year into our program, we really started to get to know the unhoused, but we also started to work collaboratively with the frontline staff that we were interacting with. So this included outreach workers, caseworkers, probation, shelter staff, hospital staff, the local schools. And then we started partnering together, which looked really good, but also put us in a position to build that trust with stakeholders and the unhoused. We started keeping really detailed files and case notes and really starting to create that lifetime map of services. Relationship with the RCMP. To make a program like this work, you really do need some support from the RCMP. In our community, RCMP were getting completely overrun with calls for service for social nuisance. Social nuisance is a broad term that doesn't really specify anything. And it's not criminal. And it was getting to the point where you were getting non-attendance or slow response.
Can folks hear Angie?
No, lost.
Uh-oh. Did you want to step in, Jamie?
I will jump in. We'll see if Angie can get back online.
You bet.
So just to summarize this piece, so a huge need, I think, to step in and support the RCMP and some of those social nuisance calls. The benefit with having the community safety officers take that function was it allowed for, taking the pressure off the RCMP and a reduction in those calls, but it also sort of allowed us to start taking a look at what the needs were in the community. So understanding, what types of calls we were getting for service and what types of neighborhoods and keeping track of that, in addition to really understanding, the population that team was serving. Next slide, please. So just briefly, Angie, are you back?
Yeah, I'm back.
I'll let you take over. We lost you for a moment. Back to you.
Okay. So as a result of the data collection, that we were able to really pinpoint what community required from us and the team. So in 2023, we came out with the Safe Public Places bylaw. And what it is it's a bylaw that sets really clear expectations for the use of and the behaviors in those public spaces. And these are going to be those private spaces, but with public access. So shopping malls, grocery stores, schools. Really lets us dig into the substance use, the panhandling, obstruction, encampments, wellness checks in those locations. And it's really unique in that there is no associated fine process. And it was actually passed and approved through our local health authority. The whole intention is to really give officers the opportunity to make contact with individuals in those locations that we initially weren't really doing before. It also gives us the opportunity to connect with and support the businesses in our community. So data really showed us a lack of supports for youth. We took that data, brought it back to the community, discussed it with partners, and it allowed us to develop the CSO, the Youth CSO program. The data also showed us that we needed more officers, boots on the ground. So at present, for the Community Safety Officer program, we have 8 full-time community safety officers. We also have the 1 full-time youth community safety officer in collaboration with our youth center, Penticton Foundry. It also showed us we needed a community safety officer supervisor, who is myself. So we're really happy about that development. And coverage now is 7 days a week, 6 to 2,300. And just again, to reiterate, we're really focusing on those encampments, the referrals, the substance use, wellness checks, first aid, referrals again, because referrals are really important. Community engagement, managing those public spaces, safety, information sharing, it's all coming into our scope of work now. So our learnings, really, the data helped us give us the baseline, but it's just a tool. So measuring or hearing from the unhoused and the partners really fills in the bigger picture, and it allows us to be flexible. So the learnings that we came out with, we learned a lot about drug use patterns and about the behaviors in our community, and it really made us transform our practices as a result. Having flexibility, so for example, starting earlier in the day for wellness checks, because first thing in the morning, the data and the experience has showed us that there's a higher rate of overdose first thing in the mornings. So we were able to sort of adjust as a result of that. And then working together with our other resources, attending community outreach coordination meetings, all of that stuff is data driven. Back to you, James.
I think I'm not sure how we are on time. So Alina, I'll hand it back to you.
Oh, sure. I mean, of course, we could speak about this stuff forever, and there's so much good stuff. A couple of takeaways, and hopefully, I'm going to hit some of the Q&As I've been monitoring. Folks asking about whether some of this information and data is going to be published, and yes, it will be. There's going to be a report coming out from us next week, so all of you guys will get to fill your boots with that. There's a couple of questions around methodology as well, and just getting more details around the hidden homeless population and how that's calculated, and considerations when it comes to warmer weather communities. Absolutely, there's an impact there, and where migration moves, there's just more pressure as well, and those warmer climates definitely have an impact, and certainly a seasonality that we see across Canada, but definitely a Western migration is definitely happening in the data set. There's also additional risks placed on economies that are shifting towards IT or technology. So as we want to become this tech hub of the world, there's actually a higher risk for automation and losses of these lower income service level jobs that are becoming automated. We're already starting to see those pressures. There's a couple of questions as well in terms of, what's the kind of takeaway of this? So, the rising trend in homelessness, it's explainable, it's expected, yet we have the solutions, we have the resource investment, but do we have the right calibration? And I think you heard that from all of the speakers. So we have an optimization, but we also have a resource gap when it comes to the right supports to be in place. We might be investing a lot, but is it being targeted towards the right population? So I leave that with you as well to consider in your work. And at the end of the day, the data that we collect, and you heard from Susan, Jamie, and Angie, how they're using the data to inform systems, really specific policy at the local level, and really specific programmatic and operational, like hearing about waking up earlier, building different kinds of partnerships. That's what the data should be there for, versus just for fun and games. So hopefully I tackled some of the themes in the questions. I promise I will in the send out of the transcript and recording, I'll address those as well, and from the speakers, but certainly hopefully that helped answer that as well. So with that in mind, thank you to all of you guys for being here today. Thank you to Susan, good friend and partner in crime for many, many years, and new friends like Jamie and Angie. Thank you for doing an amazing work and showing up today with amazing insights. For those of you that are interested in and loving these webinars, our next one is actually going to be a January 18. We're going to take a well-deserved break over December. And this one is going to be all about what's in store for the social sector and social issues in 2024. So the political climate, social data trends, housing and safety, economic influences, and technology and society. So digging into some of these themes of our forecast on what's likely going to hit the media, what's likely going to hit the reports and political debates, as we of course have an overarching national federal conversation underway as the October 2025 election is very likely to hit all of us. So January 18, please do sign up. It promises to be a fun one, connecting the economy and social issues and planning for that in your efforts moving forward. And with that, thank you very much for attending and staying on the whole time. And it looks like everybody's was happy with the content today, so appreciate that as well. Thank you. Have a great one.